The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today I want to talk to you about incorporating a little bit of supported backward bending into your daily routine. And this is really to promote the health of your lower back. If this seems counterintuitive to you, consider for a moment how much sitting we modern humans do all day long. Sitting behind the computer, sitting behind the wheel of the car, sitting to eat our meals. And no matter how erect you sit, your spine is always slightly forward bent or slightly flexed when you're sitting. And so you start to get in the habit of carrying your lower back that way. You can actually get a little stiffened in slight forward bending, which causes problems, mechanical problems down the road. So in order to avoid all of that, we just put backward bending into our daily practice, kind of like a little vitamin, if you will. So I want to show you how to do backward bending safely, and I'll give you a couple of options about how to do it. But before we proceed, I just want to say that if you've been told by your doctor or physical therapist for any reason to avoid backward bending, stop right here. Don't do it. For the rest of you, as long as you can do this motion without pain or strain, it's a great way to keep the movement in your repertoire and keep your back really healthy. So we're going to start face down on the floor, and you're going to place your feet about shoulder width apart. Hands can be under shoulders, or you can have your forearms down. And what you're going to do, whether your forearms are down or your palms are down, is you're going to press yourself away from the mat. So it might look like that with the forearms down, or if I've got more range, I can press up from my hands. Now, what's really important here is that you don't try to get as high as I got in my backward bend. You get as high as you get. And that is whatever backward bend feels good to you. So for some folks, it may be barely coming off the mat, and for others, it may be a whole lot of range of motion. But what I want to be sure of is that you understand we want to feel consistent backward bending along the spine, and not like one level is getting crammed. You know, you don't want to feel like you've got a hinge somewhere in your lower back, or that you feel cramming and sort of crampiness in your lower back. So make sure you stay low enough in your backward bend that it feels good. So I'm going to do a few with you here and just kind of show you what it might look like. You just press up off the mat and come back down, and just do 3 to 5 times. You don't need to hold it. You don't need to stay there for any reason. You just enjoy the motion. And when you're done, you move on to whatever other exercises are in your daily practice, or just get on with your day. Now, I hope this tip was helpful to you. If you loved it, go ahead and click all those buttons, hit like, hit subscribe, share it with your friends. If you want more information on how you can make your back healthier and more robust, check out our Rebuilding Your Back Academy. And until next time, I hope you stay healthy and be well.